Dr. Joyce, what are some early symptoms of PCOS? What is it, and how do you detect it and treat it?
Sure. Well, it's an excellent question. Polycystic ovarian disease, or polycystic ovarian syndrome, it's an abnormality of the hormone system in the body. So in women, the hypothalamus is supposed to speak to the ovaries, and the ovaries are supposed to carry out normal ovulation. For some patients, the ovulation doesn't happen for whatever reason, and therefore the ovaries become polycystic, or they have an egg that was trying to develop that doesn't release. The symptoms can be quite varied, so it can be difficulty with losing weight, or it can be difficulty with abdominal pain, where the ovaries are growing but not finally opening all of those cysts. It can have symptoms similar to diabetes with excess thirst, can even have symptoms of excess hair growth on the face or chest. And so there's a lot of variety to the symptoms of PCOS. Our testing with hormone testing, we can sometimes identify patients at risk for PCOS. Some families know that others in their family have had it, and so they will ask us about it if that could be their problem. But some of the best tests for PCOS are actually the ultrasound to see what the ovary looks like. And some patients, to be completely sure, need laparoscopy. So that's a surgical procedure to look inside the abdomen and see what the ovaries are doing. But its treatment can have several different approaches. There are ways of treating it with a medication called metformin, if the patient is sensitive to that. There also are some other hormonal abnormalities that we might find on the blood testing that would give us an idea of which hormones to supplement in order to correct the problem. Some of the more difficult patients to treat might even though need a procedure to allow the ovary to release the egg. And so there's something called a wedge resection of the ovary that is sometimes really beneficial and can restore normal fertility.